Why is it a big deal if I say that I have an allergy to something and so you can't give me the medication you intend to give me? Why is that important for us to know if that's really an allergy or not? Marcia, you want to start?
I'll start first. So as a pharmacist, one of the first things that we ask a patient, whether it's in the community setting or the hospital setting, we want to know a patient's allergies. And knowing a patient's allergies helps us to make sure that we give a patient the correct antibiotic, something that's not going to hurt them. But at the same time, we want to make sure we have correct allergy information, because if we take something and we have maybe an upset stomach or we got a headache, and we then tell our pharmacist or our doctor or our nurse that we have an allergy just because we had those things, that's not really an allergy. An allergy is something where we have maybe hives, and we'll go into that probably more, the physicians will, where we may be having a hard time breathing or those types of things, and that's a true allergy. And knowing if we have an allergy or not helps us to pick the right antibiotic, because sometimes patients say, oh, I have a penicillin allergy, and just because I had upset stomach. And when we do that and we label that as an allergy and put that in the patient's record or their chart, then we may not be taking the correct antibiotic. When the physician's prescribing antibiotics, sometimes penicillin is the best medication. It may have the less side effects, it may be the most effective, and so we really do need to know correct allergy information. I'm sure the physicians and Debbie as a nurse have some more to add to that.
Yeah, I think I'd add to that. Penicillin allergy is the most common allergy for medications, and yet it's one of the better medicines for a lot of infections that children get. So when that is an allergy that's listed that's not a true allergy, we many times give antibiotics that are what we call broader spectrum, which means they kill a lot more bacteria, and they also cause resistance. And so one of the theories as to why there's so many bacteria resistant to antibiotics is because we've used a lot broader antibiotics to treat infections that could have been very well treated with penicillin.
Certainly, they're both dead on this. I see a lot of patients come into clinic and they have this long list of allergies. And when you really dig into it, they really aren't allergies, they're more adverse effects. And when I tell patients a true allergy, pretend you're mowing your yard, your eyes water, you're sneezing, poison ivy, you get a bad, very itchy rash. And so a lot of patients don't really have a true allergy, it's more of an adverse effect to the drug. And not only antibiotics, but blood pressure medicines, anti-inflammatories, a number of medicines can have an adverse effect, which means that if we need to use the drug in the future for a certain medical problem, we still can. And I think it's very important for the patient to differentiate the difference between an allergy and an adverse effect.